Side, I think, through the day on Monday, still relatively cool. And then through the week ahead, a little bit up and down, still low pressure, but a hint things could turn a little bit drier and warmer as we head towards the bank holiday weekend. Charlie and Naga.
Sarah, thank you very much. See you later on.
Thanks very much, Sarah. Now, by now, if you're one of our regular Saturday watchers, you will be familiar with our panel of COVID experts, Dr. Chris Smith and Professor Linda Bauld.
So, for the first time, they will be here in person. Here, usual slot, usual time, and the usual routine. The difference for us is they will physically be with us in the building. I suppose, in a way, that is in itself a kind of statement as to how things have changed. We are, of course, observing social distancing, but they will be here in the studio with us.
Well, they won't be in the studio.
Not right here,
it's going
just
to
out
be
there.
a bit different. Bit different. And what's really exciting for them, exciting for us because we get to interview people in person, but they're meeting each other for the first time.
Yeah.
So we'll have a bit of fun around that. So if you do have any questions, this is the important bit, obviously, your questions being answered, which you know they do brilliantly. Send them in by email or by Twitter, and we'll get as many to them as possible.
Yeah, a lot of questions, of course, knocking around this week in connection with the Indian variant, to do the changes, and we were talking about Germany as one of our lead stories today. So if you've got any issues you want to address, please get in touch.
Now it is time for Click with Spencer Kelly and Lara Lewington.
Both.
Sarah, thanks very much. We're somewhere different.
You will note the change of location, and there is a reason.
Yes. Since the beginning of the year, obviously, we have been checking in every Saturday with our COVID experts. And what they've done is they've helped us understand all the developments. And I think we've all learned together how the pandemic has worked, but also try to figure out any of your questions that you send in to us.
Yes, so if we look at our other camera here, let's introduce you. It is virologist Dr. Chris Smith, Professor of Public Health, Linda Bauld. Welcome.
Thank you. Lovely to be here.
Look at you two just sitting there all live and here with us in the studio. And we should point out for viewers who've been watching for a while, the two of you, spoken many times, never before have you met.
What was it like? When did you meet? When did you first clap eyes on each
in
other?
the foyer.
Yeah,
Really?
when we came into the building.
And?
Well, I did cheekily phone up Linda last night. Well, I dropped her a line and I said, I'm eating curry and drinking Merlot in the hotel.
You know how
do you
to
want to pop over? And she said, I'm going to bed. Got to get ready for tomorrow. But no, so this morning was the first time.
We saw a sort of
album.
choreographed arrival. Was it? That was pure chance.
It's pure chance. It was entirely by chance.
Of
We
course
just
it
happened
was.
to go through the doors at the same time.
And are you fans of one another's work?
Absolutely. I was saying I've been listening to his podcasts and stealing his ideas. But no, it's brilliant. It's just great when you've spoken to somebody for so many times over so many months. But just that, seeing people in person, which so many of us haven't done, it's just exciting.
Have you two realised just what an impact you've had in terms of with our viewers? The questions have been coming in every week. We never not have questions for you guys. Have you seen? It's interesting, isn't it? Just from that first time when you were together, that you've become this double act, and it works.
It's been magical, actually, to do it. But also, I think it really speaks to the fact that it's been really good to provide this opportunity so that people can have answers to questions. Because, yes, I think some of the government web pages have been fairly easy to decipher, but many haven't. And
it
giving
changes.
people, and it changes, and giving people the opportunity to get answers to things quickly and accurately, and because things are changing so fast, I think it's been a wonderful opportunity for everybody to involve themselves like
Yeah, I agree entirely. And Linda, I would say the other thing is that because people see you as human beings, if I may say that, rather than just as experts, we have a bit of banter, I think is the phrase people use these days around our chats. And I think it helps because people, they're not thinking you're someone at a distance who doesn't have any kind of corresponding lives. You're real people too. And that's, we filmed you coming in here, and it matters, doesn't it? Because then people will listen more.
Well, also, people have been stuck at home. Not everybody, lots of key workers on the front line, but we were stuck at home doing that. And I think just seeing people in their home surroundings, but also we had a bit of a laugh, a bit of light humour about the flowers and the clocks in our tiny little environments.
We're not going to get into that just yet, okay? Hold up.
Shall we? I'll tell you
Maybe
the great
serious
thing.
first,
The
huh?
great thing about actually eyeballing each other is we can actually feel, because when you're doing it remotely, it's kind of like, well, I'll answer this question as fully and as fully as I can. Now you can see just how many we've got. Got loads. Okay, so let's start with Dino, shall we? Dino. Are the number of new cases relevant? Is it not the number of new hospital admissions that we need to watch? I think this is more for you, Linda, and then act accordingly on that information.
So this is a question that's coming up a lot because we're still reporting the cases, people in hospital, ICU. We are actually concerned about a basket of indicators, but the reason we're still talking about cases, and I think we will continue to, is because there was a trajectory from people becoming or testing positive. We are actually concerned about a basket of indicators, but the reason we're still talking about cases, and I think we will continue to, is because there was a trajectory from people becoming or testing positive to going into hospital, ICU, and potentially mortality. So I think the key thing for the government is still hospitalisations and deaths because we want to protect the NHS and save lives. But we're still a bit worried because of unanswered scientific questions about cases leading to those outcomes, and that's why we're still talking about them.
Okay.
Let's pick up on a question from John, who says, why should school children be sent home if a person unknown in their bubble gets COVID? So this is John's story. My grandson has now been sent home twice, therefore missed 20 days of school. He's taken lateral flow tests regularly, and they've been negative each time.
Well, the reason that we put people at home for a while is because this is a transmissible infection. It's a respiratory infection. And if you're sharing time, sharing a classroom, sharing air with somebody who could pass it to you, there is a theoretical risk you could have it until we know whether or not that person who was the source contact for you really has it or not. So the idea is all about breaking the chain of transmission. And the fewer contacts there are between individuals, the fewer opportunities there are for the infections they have to pass to other people. So it's all about breaking chains of transmission.
So it's not necessarily about how ill the children are going to get it, it's about their families.
It's about the onward
families.
connections, because every child has a family. That family could catch it from them. That family could include vulnerable people.
Amy says, and this is again, there's been a lot of discussion around those who are pregnant, and of course you remember at the start who were the pregnant women. They weren't part of the trials, were they? So they were advised not to have the vaccine. Amy says, I'm currently breastfeeding my daughter. It's recommended that breastfeeding women get their jab when eligible. In all honesty, Amy says, I am nervous about this. Linda?
Well, it's a really good question from Amy, and also Amy's doing a brilliant thing by continuing to breastfeed her infant, which is really important. If you can do it, that has so many benefits. We can be reassured that women who are breastfeeding are not at any risk when they get the vaccine. It's approved for use in those women. And also there may actually be benefits for the baby. So there was a paper out not long ago showing that the antibodies that are developed as a result of receiving the vaccine are passed on to the infant.
And that happens through breastfeeding anyway, doesn't it?
Yeah.
In those who can, and there's no pressure, of course, to do that, but those who can, that is one of these advantages.
So it's absolutely understandable that Amy's nervous, but I would say go for it and be reassured.
Chris, just pick up on a slightly wider thought, if you would, about people are being accustomed to our daily figures. And we've all seen the charts, and I don't know to what extent people now maybe are switched off a bit. Anecdotally, I'm hearing a lot of people who are slightly hands over the ears about this. But when we look at the Indian variant now, which is the major cause for concern, and we look at those numbers specifically, what are the things that people need to pay attention to in terms of where this is going?
Well, we're worried about the possibility of a new variant emerging that could sidestep the protection conferred by vaccination. So it's important that we're vigilant to the appearance of new cases of these things. And one of the reasons why people are worried is that we still have a significant proportion of the population that haven't been vaccinated yet. So if you have something that can spread and spread faster than the native coronavirus we have in the country, it could increase the number of cases in people who are vulnerable, and therefore also get into people who have been vaccinated but are not necessarily immune, because not everyone who gets vaccinated is protected. So we need to keep an eye on where these variants are and how many there are, for the simple reason that the more variation there is, the more chances there are we're going to see the vaccine stop working.
And Linda, maybe you pick up on this one, but people will be aware that, statistics, we were talking, I think, at the beginning of this week about a 30% increase over what a period of maybe 4 days of the number of cases of the new Indian variant. Now, that maybe doesn't sound like that much, but that's a very significant figure, isn't it?
It is a large figure, and what we expect is that this variant may become the dominant variant. I mean, just to emphasize, this virus is changing all the time. Some of these variants have a competitive advantage, and it looks like this one does. So the reason you're seeing an increase is because you have transmission, there are outbreaks, and it may well become the one that we are living with commonly in the way we were with the B117. But I don't think people should panic. The key thing there is that local public health response, mass testing, support to self-isolate, and then accelerating vaccines. And we're doing those three things in all of the areas affected at the moment.
Glasgow is one of the areas
It is,
affected
that's right.
at the moment. Do you want to just tell us a little bit more about what is happening there? Because we're hearing about surge testing and test and trace, more in test and trace in various areas across the country.
So as we open up, we always expected infections to rise, and that's what's happened in Glasgow. And so they're stuck in a level where they don't have as many things open as a result. That's a decision by the government. But there are cases of this B1617.2 variant there. So again, surge testing, particularly in two postcode areas in the south of the city, and also younger people are able to come forward for the vaccines. Final point, the really crucial thing is that people who haven't received the second dose, we must find those individuals, some of them older, and make sure they receive it.
When you say younger people, 18 plus?
Yes, adults.
Right, okay. And it's interesting you talk about the second dose because Emma has said, I've had my first vaccination, which was AstraZeneca. Now, based on reports of rare clotting problems, I still feel nervous. Now, I'm assuming that Emma didn't have clotting problems after the first. She says, is it okay to try to get a Pfizer or a Moderna jab for her second dose?
So do you want me to answer that,
Yes,
Brizzy?
yeah,
And then I'll pass over to Chris. So the Joint Committee on Vaccination and Immunisation has been very clear about this. You have the same vaccine. So for whatever you had for your first dose, you have for your second dose. And people who haven't had a first dose and are under the age of 40 are currently being advised to have Moderna or Pfizer. Final point, as we've discussed before, there is a trial looking at dose mixing, and we will get results on that very soon.
I thought that wasn't as successful in terms of the results, some of the early results from that.
The evidence we have from prior to coronavirus is that mixing vaccines actually is probably going to lead to even better protection in the long run. And this is called a prime boost strategy. And there are various reasons why it works. There's a trial going on at the moment to test what is going to happen if we mix and match between different vaccines, just to make sure, because at the moment we don't have the evidence. It doesn't mean we suspect it won't work. It just means that we can't say to people, if we do this, this is the outcome.
But are you talking about are you talking about first and second jabs, or
Yes.
are you talking about, say, you've had 2 jabs of Astra and then the next one you have is Moderna, for example?
Both are being explored. There's a trial to actually look at what happens if we mix between 2 different types of vaccine for first and second doses. There are also trials ongoing now to look at what happens if we come back and boost somebody who's already had 2 doses of another vaccine. It will come down to some people might not be able to use the same vaccine they had previously. It might be the supply is affected for that one, or it might be we discover that because of the way some of these vaccines work, once you've had 2 doses of them, you need to switch to a different class of vaccine for follow-up booster doses in order to get the same level of response that you did previously. So all of these irons are in the fire, but the intuition we have and our instincts are it will probably work better to mix and match between vaccines than just to have 2 doses of the same thing. But let's not...
Do you want to pick up on so sometimes the gap between science and anecdotal conversations? A lot of people at the moment who've had 1 jab, maybe 2 jabs, having that conversation. What was it like? How did you feel afterwards? You know, what was your reaction like? Now, you know, are there any scientific patterns as to who's reacting in a certain way between men, women, age groups? What are we seeing?
In the initial trials that they did, there was a trend that the older you were, and there are not many things that improve with age, but this was one of them, the side effect profile improved, and older people were less likely to report more severe side effects than younger people. And that's probably because as you get older, your immune system becomes a bit less agile, and the symptoms you get in response to a vaccine are chiefly because of your immune response. When you get the flu and you have total body symptoms and you have muscle aches and pains and you feel feverish, the flu isn't accessing all areas. It's making your immune system send signals to everywhere that makes you feel ghastly. And it's the same with these vaccines. They're winding up your immune system just for a short while and making you have total body symptoms. So age is a factor. But we did a straw poll among the doctors I work with at the hospital, and roughly half said they got more symptoms the second time, roughly half said they got fewer. So on the whole, I don't think there's a clear direction at the moment. We don't really know for sure.
So
Linda, I was just going to say, I'll say it out loud now, quite a lot of people anecdotally are saying man flu. Frankly, men are complaining more. As simple as that. There's not much science to that, but
No. Yeah, I think, as Chris says, there's no real clear pattern. So I think, yeah, men might complain more, or some men might be more susceptible, but I don't think we know the answer to that. Final point, I'd say sometimes, if you look at the numbers in the MHRA's yellow card system, there are actually more women who report some side effects. And that may be because women are more likely to report a side effect, as in they're more likely to go to the doctor sometimes, aren't they?
So what I took from what Chris said is if you're an older person who's had the vaccine and you've had a reaction, you should feel quite good knowing that your immune system is kind of robust.
Possibly, but we shouldn't read too much into this because some people are saying, well, I haven't had a reaction, therefore I'm worried I'm not going to make a response. But actually, in the trials that were done, about 100% of people did develop antibodies to these vaccines after the second dose of vaccine. So everyone responds, but some people are going to respond a bit more and a bit sooner than other people. We're all different, and older people in general do respond less well to vaccines than younger people. One other point on the different ranges of symptoms people get, there is a trial going on at the moment, as we've just been saying, looking at different vaccines in different orders, so mixing and matching between vaccines. And what that trial is showing is that if you do have a first dose with one vaccine and then switch to another vaccine and effectively have the second dose with a different vaccine, those sorts of regimens do seem to produce slightly more side effects than if you have 2 doses of the same vaccine.
Good. Okay. Jim says, and this one for you, Linda, a member of my family is concerned about having the vaccine. It goes again to trying to get these people who haven't yet come forward, because she's been told it may affect her fertility. Is there any evidence for this?
No, there isn't. This is a very common question. And of course, when initially, as you were saying before, Naga, pregnant women were not necessarily advised to get the vaccine, there were lots of questions about fertility, but there's no evidence at all from anywhere in the world, either from the trials or the many millions of people who've been vaccinated now, that there are any links between fertility. And in fact, Chris can comment on this, but there isn't a biologically plausible reason why this vaccine would affect fertility.
Why is that?
Yeah, no, I can't think of a reason why it would have any kind of impact on fertility at all, more so than any other vaccine anyway. So I think really we're reassured that there is no impact on fertility. But what we can say is if you catch coronavirus and you get pregnant, then all of the consequences, all of the complications of pregnancy become significantly more common, about 50% more common, things like high blood pressure, preeclampsia, diabetes, but also complications in your newborn are much more common as well if you catch coronavirus when you're pregnant. So as far as we can tell, the best thing in terms of fertility is to get vaccinated rather than not get vaccinated.
Linda, do you want to pick up a question from Dan? And this, I suppose, is a broader question. Obviously, all public health focusing on coronavirus at the moment. Other issues, do exist alongside. Dan says, is it possible that the COVID-19 vaccine offers protection against other viruses, such as the common cold? Could we see less pressure on the NHS next winter as immunity builds and boosters are administered?
So we don't have any evidence that this vaccine necessarily is going to protect against the common cold, even though, to emphasise, the common cold is a coronavirus. That's how we develop a common cold. But we don't have any evidence of that at the moment. What we do have evidence of, and what I think Dan's observing, is that there have been fewer colds and flu in the UK population as a result of the pandemic. And that's nothing to do with the virus, it's to do with public health measures. So because we've been washing our hands more, we've been wearing face coverings and we've been distancing, we haven't been able to pass on other viruses. And that's a phenomenon we've seen around the world. But unfortunately, we can't say that the COVID vaccine is going to prevent you from getting a cold.
Do you think social distancing should remain in place then? Considering, so few people, anecdotally people say they haven't had a cold.
I've had fewer colds, but then I have got 2 children who make sure I still catch my fair share of colds, as any parent will well know. I think we all agree we're all humans and we're all hating the present situation, and we can't carry on like this forever. We have evolved to have a very good immune system that defends us against the vast majority of things that try to attack us and gain a toehold on us, and most of us are healthy for most of our lives. But it's absolutely true, there have been almost no cases of flu around the world this year. This effect was first picked up in Australia and New Zealand because coronavirus came home to roost and started during the winter in Australia and New Zealand. Then it was our summer, then our winter here, and we got an absent flu season as well, which is really reassuring. And as Linda says, it's down to public health measures, but there is a problem brewing. Normally, we keep on top of flu because all around the world, there are thousands of laboratories which are detecting samples of the flu and sending those samples in. And that enables us to keep track on what the flu is doing, whether the vaccines we're making will defend against the circulating strains of flu, and how we update those vaccines. Well, flu's completely gone off the radar. We have no idea what it's doing, what it's turning into, how it's evolving. And at the same time, because no one's catching it, our own natural population immunity is dropping. So the prediction is that when flu does make a comeback, probably because we'll have scaled back our social distancing and travel will resume around the world, we're probably looking at a bad flu year. So
Can't you mix it with the coronavirus vaccine, with the booster season?
Oh, so in terms of the vaccination, yes, just to absolutely agree with Chris, I think not just for adults and flu, but we're also worried about children and respiratory viruses, which could affect them. Pediatricians are worried. In terms of the vaccines, yes. So the Green Book, which is what we use to talk about vaccination and give guidance to clinicians, says that you can deliver the influenza vaccine and the COVID vaccine at the same time if required. Now, if we think about our own behaviour, that might be really convenient for people. If we look to the autumn and they need to have another COVID vaccine, those that are eligible for the flu vaccine. So I know that we're already planning, or my colleagues are, potentially to deliver it in that way, but we'll wait and see what happens.
Ever so slightly disappointed, because when I first caught a glimpse of you two this morning, you sat on the sofa earlier on, you were both in red. Like you'd done a deal that you were going to wear red, but you were ordered to change, I understand. Is that right?
It's this psychic
We've
link
done this
that we
several
have.
times.
Somehow, is that true? You have actually...
But it was felt we were a bit too red. And
Right.
so I did have a blue shirt on, so I ditched the jumper. Would you like to see the jumper?
Have you got it?
Oh, okay.
I do, actually.
Right, yeah, show and tell.
What
We
were you
always
gonna
like a bit of
say,
show and
Linda?
tell.
I was going
Yeah.
to say this
There
has
we are.
happened before because we
So
can't.
you can imagine what I would have looked like wearing
There you
red.
go.
There
Twins.
go.
Twins.
Nice.
Same pod. You said it's
Yeah,
happened
because
before.
we can't see each other when we're filming with you when we're at home. It's been surprising to watch back, or people have sent us a clip and discover on several occasions we've been wearing the same colour with no communication. So there must be some kind of
Well, what we've picked up in the kind of the symmetry and the telemetry between you is their love of plants.
Yes. Now, I'm going to have to...
You don't know.
I don't know. So
Right,
we
okay.
have a selection of plants here, and
This
they have been
one-
designated towards one or other of
They're
you. Now, I
gifts.
can't remember which one's which.
Well, I can. This one is for Chris.
Which one? The big one?
The big cactus.
Which we won't
cacti.
touch, obviously,
We're not going to
but-
touch. So that one's for you, and the orchid is for you.
Oh, that's
Linda,
lovely.
Because
That's
we know you
beautiful.
like flowers.
Thank you.
And we
I love
understand that.
flowers.
So we just wanted to make you feel at home. We were going to put them behind you, but we couldn't quite figure it out because that's obviously what you two do. So next week, again,
See you next week.
see you next week.
Yeah,
Probably
absolutely.
not here. We're not
Probably
sure
virtually.
yet. Probably virtually.
Sometimes when people meet and they haven't met before, it can be a disappointment. So what? Are we okay? Is everything all right?
Yeah, is it all right?
It was great. I mean, it's been fantastic being here, and we've chatted about Eurovision. We've not been talking science.
Watching Eurovision tonight?
Well, I'm up for it. I'm
Well,
actually
Linda's
really
talked me into it. Because I
There you
said
go.
I've been out away from Eurovision for about 20 years. I remember the last time I actually watched Eurovision, I was saying to Linda, I remember Terry Wogan was doing the commentary.
There you go.
And he
It
said,
is-
there you go, there's all the votes coming in from the Ukraine, making sure the gas stays on. And I thought it was such a good line. And I just thought I lost all confidence in Eurovision watching us get 0 point again and again and again. But maybe I'll make a
He's
comeback
watching
this
it
year.
tonight.
The joy
Good.
of it.
Good.
Charlie said that sometimes when you meet new people, it can be disappointing. You know them across the camera, down the lens, and then you meet them in person. Anyway, shall we go to Matt Tebbett, Saturday Kitchens, on after this programme?
But it's you have to do that every day, really, to build up
Hard
strength.
work.
But yeah, very important to do that, so your head doesn't come off, as you were saying.
Yeah.
Thanks, Mike.
Thanks,
Let's see.
Mike.
Time now is 9:44.